Breathing is a symbol of life. Deeper the breath is, greater the victory of life over threatening irritants are. Today, to discuss various breathing problems, we have Dr. Seema, who is a pulmonologist with PVS Hospital, Cochin. Welcome to the show, Doctor.
Thank you.
Let's move on to the first question, Doctor. Well, what is a bronchial asthma?
It's a chronic disease. Actually, the incidence of bronchial asthma is increasing now. Firstly, because of more of pollution and exposures, now the incidence is increasing. Secondly, also because we have better knowledge about bronchial asthma, it is getting diagnosed more now. So definitely the number of patients who are coming with bronchial asthma is increasing. It's a chronic disease. It's a disease that affects the airways. By the airway we mean the air, like the column which carries air to the lungs. So it's a tube that carries air to the lungs and out of the lungs to the atmosphere. So it's a inflammatory disease. What we mean by an inflammatory disease is it's a disease that causes swelling of the airways. Because of the swelling, it's inflammation, as I've told. Because of inflammation there is swelling, and because of the swelling there is oozing of secretions into the airways, which causes thickening of the airway. Along with that, it causes mucus plugging, so that the airway gets narrowed, and that leads to a difficulty in breathing. It's difficult to diagnose asthma. Like many other diseases can be misdiagnosed as bronchial asthma. So to diagnose, first foremost thing, the patient who's coming may come with a history of coughing, cough that lasts long, maybe after infection the cough lasting long, or there may be history of breathlessness, a tightness in the chest with wheezing, that's a whistling like sound, and these symptoms or trigger or following. These symptoms occurs mainly after exposure, like exposure to either dust or any other triggers, or it can be a simple cough that lasts long, like more than what happens in a normal individual. So in those if you are having any of these symptoms, definitely you need to seek a medical advice to rule out a bronchial asthma.
Well, there is this relevant question, how do you recognize exacerbation and how to manage at home before going for medical help?
If you have any symptoms that is more than your daily routine symptoms, any worsening of symptoms compared to your routine symptoms, definitely, or following any exposure or during an infection, you are having more of symptoms, probably that's an exacerbation. So first and foremost thing is that you should be able to identify your exacerbation. For that, most important is before you should know when to seek a medical advice. So you should be having what is known as a written action plan for before, even when you are seeking a medical advice for the first time. Discuss this with your doctor and have a action plan for yourself. Asthma treatment is mainly, it's an individualized treatment. You cannot prescribe a same medication for all people, all the patients, or the same treatment for everyone. So when to seek a medical advice, that's the most important thing, and how to manage the thing before going to how to manage at home before seeking a medical advice. So whenever you have any exacerbation of your symptom, first and foremost thing is don't get panic, because if you get panic, definitely your symptoms are going to worsen. And in the medications we advise, one is a reliever medications and one is a controller medications. So take a medical reliever medications immediately on starting your exacerbation. First thing, don't panic, take a reliever medications, wait for some time for your symptoms to improve. If they are not getting improved, again take a reliever medications. Inhalers are the best reliever medications. And if you are still not getting control, definitely without delay seek a medical advice.
Well, we have few questions from the audience side. Doctor, this is the first question.
Myself, Gokulam Kumar, second year MBA student of Bhavans Royal Institute of Management. My question is bronchial asthma is a hereditary disease?
Yes, bronchial asthma is a hereditary disease. So it may not be a family history of asthma itself. You may be having your uncle or your aunt or your grandmother, anyone having not only history of bronchial asthma, there could be history of any allergic rhinitis, history of allergic dermatitis, eczema in the family. Again, you may have a bronchial asthma or any other history of allergy. Then again you are at risk of having a bronchial asthma. If you ask me, like, is there any way you can avoid having bronchial asthma? I am sorry, there is no way as such. But definitely along with the hereditary thing, there are many other environmental factors which modifies bronchial asthma. Also your lifestyle problems like smoking, again it's a very high risk factor, because we see like most of the patients have poorly controlled asthma because of smoking. So along with genetic factors, definitely environmental and lifestyle causes do play a important role.
This is the next question.
Myself Vishnu ML. I am doing MBA in Bounce Role Institute of Management. Sir, I have one doubt. Is there any specific test for bronchial asthma?
Yes, there are specific tests for diagnosis bronchial asthma. First and foremost thing is you should suspect you are having a bronchial asthma and seek medical advice. So it's the doctor is the best person who can diagnose your disease. So we have a test known as a pulmonary function test, where you can assess what are your lung functions and accordingly prescribe medication for the same. Also you have allergy skin testing to see what are your triggers or what are your exposures that can cause an exacerbation. So avoidance of these things or the triggers are the best treatment for the initial management of bronchial asthma. Other than this test, because all allergens cannot be tested, so you can have other blood investigations done, which like increased raised eosinophil count. Again it is unfavorable of having an allergic manifestation. Most important, the management of bronchial asthma is education. You should know what is the disease. You should accept that, because we find the most difficult thing in the community is accepting that you are having a bronchial asthma, because it's considered as a stigma in the community to accept that your child or your someone in the family is actually having a bronchial asthma. So firstly you have to accept that you are having the disease, and most important is education, knowing what is the disease and also what are the triggers. The triggers again can be an indoor or an outdoor pollution. So indoor, like you have different exposures like dust, cockroaches, fungal exposures, or like exposures of old books, smell, especially of perfumes and any other frying smells. So again you have to, these can be the indoor triggers that can cause an exacerbation. Other than that, outdoor exposures like pollution, other than that different pollens again. So you should avoid exposure, like if you are having an indoor exposure, try avoiding that exposure by going out of the house. At the same time, if you are having a more of pollution outside or pollen problem outside, try to stay indoors during that time. So first and foremost, most important is avoidance of a trigger. Then you should have a written action plan, like what are medications you are taking, what are the importance of the different medications, and what to take when. Mainly in asthma treatment we have two types of medications. One is which is known as a controller medication, which is mainly used to prevent the disease or which controls the disease, and second is the reliever medication. So as the name itself suggests, reliever means it relieves the symptoms. So when you are having an exacerbation or when you are having symptoms, at that time a reliever medication will be more useful than a controller medication. So take a doctor's advice, decide which, because he is the best person to tell you. Never take over the counter prescription, because you may not be requiring, and more reliever use may shows that you have a poorly controlled disease. So preferably seek a medical advice, take the prescribed medications always correctly in the same dose as has been prescribed. Never take what we see in our patients is, most of the patients when the symptoms are better, they shift to only when required medications they take as and when. But actually the patients require a long term medication. It's a chronic disease. I have already told, bronchial asthma, it's a chronic disease. That means it requires a long term management, and it requires a long time treatment to bring down the inflammation that is there in the airway. So always take medication as prescribed by the physician, your treating doctor, and never take as prescribed by the pharmacist or just over the counter medication. So main treatment is inhalers, and second, along with the inhalers, some drugs may be prescribed to bring down your symptoms. Along with medications, lifestyle modification like avoiding smoking, avoiding other maintaining healthy lifestyle is also important in asthma control. We see like many times the patient is taking inhalers regularly, but still the symptoms are not getting controlled. In those patients, definitely the inhaler techniques are likely to be wrong. So always check with your physician whether your inhaler technique is correct. Are you taking the medications in the correct way? Because unless you take the medications in the correct way, these drugs are not going to be effective. The role of again good maintaining a good lifestyle, exercise cannot be ruled out. Physical exercise, mainly aerobic exercises, yoga is also helpful in controlling the symptoms. But before starting your exercise, definitely seek a medical advice, because even exercise can cause a worsening, can precipitate worsening of symptoms. So definitely, so you may require different medications to prevent an exacerbation during exercise. So before starting exercise, definitely do seek a medical advice and optimize your medications accordingly, so that you don't get an exacerbation following exercise.
This is the next question.
I am Vishnu B from Bhavan's Royal Institute of Management. Sir, I have a doubt regarding is inhaler safe?
Yes, inhalers are the safest medication for the treatment of bronchial asthma. Inhalers, as I've already told, like there are many misconceptions about inhaler, that they are supposed to be harmful for the lungs, but they are the medications that reduce, as I've already told, there is mainly inflammation of the airway. So these are the drugs that mainly reduce the inflammation in the airway. And along with that, there is another misconception is once you start inhalers, you require it for a long time. There is not such a thing. Like once your symptoms are controlled, definitely your physician is going to reduce your inhalers. And if it's treated in the mild disease, in the earlier stage itself, inhalers can be stopped after some time. But again, seeking right treatment in the right time is important. Once there is what is known as airway remodeling, once the edema persists and the airway remodels, there is change in the structure of the airways. After that, it might be difficult to stop medications. So initial treatment and initial management is important in the treatment of bronchial asthma.
Well, Dr. EBIS is a diagnostic procedure, and I don't think it is actually done in a lot of other centers. I think very few centers has this. So I think PVS is one of the center where it is done. So can you just tell us something about this?
EBIS stands for endobronchial ultrasound. So it's a procedure in which ultrasound is what is done in bronchoscopy is actually we insert a tube into the airway to look for any malignancy or any abnormalities in the airway. So this is of importance mainly in cases where the lesion is outside. Like if the lesion is inside the bronchus, we can see it through a bronchoscope and take the biopsy and other samples from the lesion itself. But what happens if the lesion is outside the bronchus? You cannot see anything from the inside the bronchus lumen, bronchial lumen, from where you can take the biopsy. In those patients, definitely EBIS has a role to play. So in those patients, we use this EBIS. It has a bronchoscope with a ultrasound probe attached to it. So when you insert the probe into the airways through the ultrasound machine, you can see the lesions very clearly, and from that you can take the sample for evaluation. So it is one of the diagnostic procedures which is helpful in patients when the lesion is outside the bronchial lumen. So especially in cases for diagnosing malignancies where there is no intraluminal lesion, the lesion is outside the bronchi, we can see the lesion with the ultrasound probe, and we can, under guidance, USG guidance, we can take sample from the lesion itself.
So what do you mean by individualized treatment for bronchial asthma?
By individualized treatment, we mean that all patients may not require the same inhalers. Like there may be different triggers, like for one of the patient the trigger may be a dust exposure, but for some other it may be a different trigger. The first thing is you need to identify what is your trigger, what causes an exacerbation. Also, like some may be having a mild asthma, like only a symptoms once in 2-3 months when following an infection, which is again a trigger for a. So some may be having only chest tightness, wheezing during an infective episode. So they may be requiring medications only during that period. They may not be requiring a long-term treatment. But if it is limiting your activity, day-to-day activity, and you are having early morning symptoms, when you get up in the morning you are having chest tightness, you are having a wheezing, definitely that indicates symptoms more than 2 or 3 days a week. That indicates you require a controller medication. As I've already told, you have two types of medications, a reliever and a controller medication. So that definitely you are a patient who are a candidate who requires a controller medications. Again, you may require depending upon how much is your severity, you will require varying doses of steroids. Steroids, if taken orally, definitely has multiple side effects. And what is inhaler is the safest steroid form of steroid, because you are getting a steroid in an inhaled form and you are not ingesting the steroid, so it is not getting metabolized by the liver and your whole body is not getting exposed to it. But because you are taking inhaled steroids in inhaled form, it is the safest form of steroids that can be taken, and your dose of steroid again will depend upon what is your severity of your problem. And once your symptoms are better, definitely your prescribing doctor will reduce the amount of steroid that you are taking. So as I have already told, it is the treatment depends upon what is the severity of your symptoms and how better you respond to your medication, especially to your inhaled steroids.
The apprehension in everyone's mind is that if a person can lead a normal life in bronchial asthma, is it the case, doctor? If you can just tell us something about that.
Asthma is a chronic disease, I have already told, but at the same time it's a disease that can be very well controlled with medications, and it's a disease which improves with medication, unlike like what other disease like affects airways, which is known as COPD. It's a disease that is caused by smoking, but asthma is so that's a disease which will not improve with medications, but definitely bronchial asthma is a disease that responds very well to medication, and whatever the inflammation or the edema that you have in your airways comes down if you take regular medications. So if properly treated on time, definitely it's a disease with which symptoms can be controlled very well with medications. You can lead a normal life. You can sleep comfortably at night without an exacerbation or disturbed sleep because of asthma, and you can lead a normal healthy life with no problems in your life.
Thank you so much, doctor, for being here and giving us this valuable information. Well, this is almost the end of the episode, and I've already told you breathing is a symbol of life, so you need to stay healthy for that. Stay away from bad habits. Until we see next week, you can always send us mails on youthdiaryroseball@gmail.com. Till then, bye-bye.